in collaboration with the Cyprus Mail. This is the Cyprus News Digest with Rosie Charalambous.
Coming up this week, the Under-Minister for Tourism has high hopes of increasing cruise traffic to the island.
The customers of this ship, most of them from the US, they've actually never been to Cyprus before. So this is their first opportunity to see our island, to see the weather, to savor our hospitality. And then this is a great chance for them to start thinking, hey, maybe I can visit the island again for a longer holiday.
A study is underway to improve facilities for people with traumatic brain injury.
We estimate that the cost of brain injury accounts for about 1% of the Cyprus GDP, so that's a very expensive condition, so to speak.
And it's pantomime time again.
The pantomime consists of jokes, slapstick, singing, dancing, maybe a ghost might even turn up. Sweet throwing, kiddies on the stage helping the dame with her magic trick.
The 90,000-ton Royal Caribbean cruise ship Jewel of the Seas docked in Limassol last week, carrying over 2,000 passengers. And the press were invited to tour her with Cyprus Deputy Minister for Tourism, Savas Perdios, and with Royal Caribbean's Director of Hotel Operations, Christos Karavos. When I spoke to them, I asked the Minister how significant it was for our tourist industry to have such large cruise ships visiting the island more frequently.
It's very important, first of all, from a marketing perspective. Because sometimes when we're talking about cruising, we're only talking about how much it's going to offer the local economy during the excursions, etc. But actually, the customers of this ship, most of them from the US, they've actually never been to Cyprus before. So this is their first opportunity to see our island, to see the weather, to savor our hospitality. And then this is a great chance for them to start thinking, hey, maybe I can visit the island again for a longer holiday. So in terms of marketing, that's huge. And also the second reason why it's so important, the last decade has been very difficult for us in terms of cruising. We went from around 300,000 passenger arrivals in 2010 to almost nothing a couple of years ago. So last year we felt that the interest has started to come back to the wider Eastern Mediterranean region. And that's why we had 30 arrivals, this year 60, next year 100. And generally, this interest that is now coming back, we really want to make sure that we take advantage of it.
Most of the cruise ships, I think I'm right in saying, stop only overnight in port. So the passengers have only a few hours, really, to see the island and get that message you're trying to get across. Is it enough?
Look, you could say no, but it's something that Cyprus will try and use to our advantage. Because Limassol is an hour and a half maximum from every single point of interest in Cyprus. So with our excursions, and actually the ministry is getting very involved in these excursions now just to guide the private sector towards the right areas. It's an opportunity for people to see as much of the island as possible, and not many other destinations can say the same. I'll give you an example. The pyramids, they're 3 hours from the closest port. In 3 hours, 3 hours to go, 3 hours to come back. Whereas in Cyprus, in 6 hours, you can do a lot. And if we manage as a country to offer the excursions that are experiential for customers to create lasting memories, I'm sure that ships will start being interested in overnighting here or staying 2 nights. And that's going to be the ultimate aim.
How do you implement something like that? You've got to start presumably with berthing fees, then you've got to talk about the length of cruises that people tend to go on in the Mediterranean. I think this one is a 12-day tour, but there are shorter ones and possibly longer ones.
Yeah, look, I don't think it's an issue of berthing fees. It's an issue of branding, of getting people interested, of showing them the right product. So we've started from the very, very bottom. We've brought in companies that supply excursions, make sure that we made sure to explain to them what our vision is for cruising, explain to them our thematic routes, the ones we feel that can differentiate Cyprus, whether that's Troodos Mountains or other areas of Cyprus. And then the next step is to inform the cruise companies like Royal Caribbean or others about what we can offer. And then it's a mix and match relative to what programs or nationalities or age groups they represent.
And what about the seasonality? Because cruising, I take it, is one of the big opportunities. You keep banging on about winter tourism, and we've been talking about it on the island for years. Could we get more cruise ships coming in the winter months for the winter Mediterranean sun?
That is exactly our target, and that is exactly what's going to happen. You will not see cruise ships like this coming to Cyprus in the summer. And the reason is, there are many competing destinations that offer a great product in the summer, whether that's Croatia, whether that's Greece. And our opportunity as an island is actually the winter, because we are one of the few Mediterranean islands that people can visit in the winter. So that's key for us. And we know as well, Chris can confirm, that many of these companies, they are looking to deploy their ships to the East Med, let's say, in the winter, because of the good climate, the good weather conditions. Whereas in the summer, you go to several other places, right?
Well, the plan for Royal Caribbean is to develop the Eastern Med as a new cruise destination in the next 5 years. So all through our brands, from Azamara, Celebrity and Royal, we are looking to call into Cyprus and the Eastern Mediterranean. So we are working with the Deputy Minister, we are working with the Greek government and the Israeli government to have more calls into Cyprus. Next year we are doubling almost the capacity of our ship that we bring here, and we are adding another call, because the experience so far has been excellent to our guests. And with the assistance of the Deputy Minister and the Ministry, we boarded people from the Ministry in Haifa. They spend the whole day informing the guests with the tourist maps and the excursions that we offer to Cyprus. Last time we were here, we had 1,200 guests go on tours, and today we have 1,400 guests out of 2,900 on tours, which is a great percentage of people to go out and see the island. And we also offered a free shuttle service into Limassol town for people to go and visit on their own the town of Limassol. So great experience for our guests.
How easy is it in Cyprus to get that number of people off and on board again before you sail? Because we've had a lot of infrastructure improvements, I think, to Limassol Port. Does it match up with the other ports you visit?
It is up par with the other ports. The way it is right now, where the buses stop, where the tours are, where the shuttles are, and where the port is, the new terminal is up par with the biggest ports like Barcelona, Civitavecchia, and so on. So in many areas, a lot better in comparison to what we have. So Cyprus have done very, very well on that.
And you did mention, I think, that you're going to up the number of visits to Cyprus. Will it just be one ship doing this part of the Mediterranean, or are there different packages going to different countries, one stop of which might be Cyprus?
Different packages to different countries, including Cyprus. I know our sister brands, Celebrity and Azamara, also come here. I'm not sure of their deployment for 2020 and 2021, but I know for a fact that the Explorer of the Seas, which is 120,000 tons, 3,900 guests, next year will be here 3 times. We offer, I think, in the region of 16 different tours, from private safari tours with jeeps to the Kiko Monastery, to Paphos is very popular. I think about 700 guests went to Paphos tours, to Kourium and so on. So it's very historical, but also wine tasting and the local experience. So the tours are improving a lot. I came to Cyprus with the Legend of the Seas back in 2007, and the difference between 2007 to now is tremendous. And the cooperation, it has been amazing. I mean, we have musical dancing and singing outside, we have a buffet, we have gifts for our guests, we give them a tourist map. These things didn't happen before. We were not that welcoming anymore. Actually, it was a little bit embarrassing for me as a Cypriot.
You know, the guests today, the guest expectations, they're changing. The traveler of the future is not the same as the traveler of the past. So they want different things, they want experiences, they want to do things, not just see. So our ministry has got involved to make sure that the suppliers, they have the information that they need. We have tried to help out on the quality side, making sure that the experience is correct. As Christos said, the arrival of the guests, we wanted to make sure that they understand who we are as people, how hospitable we are. And that's why we wanted to arrange the gifts, the dances, and the whole event, because that's what can differentiate us, I think, from other destinations. And the big advantage of Cyprus as a country is that we are small. When you are small, you care more about your visitors. And this is what we told Christos, and we are living up to it. The Royal Caribbean has a chance now to be in constant communication with the Deputy Ministry of Tourism. And that's huge. And it's not only a fact for Royal Caribbean, but anybody who wants to come to Cyprus and do business. We are a small country, and that gives us a chance to have that extra personalized touch with them and help their experience as much as possible.
Deputy Minister for Tourism Savas Perdios and Christos Karavos, Royal Caribbean's Director Hotel Operations.
In collaboration with the Cyprus Mail, this is the Cyprus News Digest with Rosie Charalambous.
I'm at the University of Cyprus this week, and I'm going to talk to Fofi Konstantinidou because she is heading up some research that is called brain rehab. She is, of course, from the neuroscience department of the university, and she joins us now. Fofi, what's the actual reach of this research that you've started with funding, I think, from the Cyprus Research and Innovation Foundation?
We're very excited about the brain rehabilitation project, and the project is a natural progression of our existing studies at the Center for Applied Neuroscience and the Department of Psychology at the University of Cyprus. Living in Cyprus and repatriating in Cyprus after several years of working in neurorehabilitation research in the US, it became very clear to me that we have tremendous need in the area of epidemiology of traumatic brain injury, in the area of outcomes post-traumatic brain injury, and also in establishing rehabilitation methodologies. So the scope of the study is threefold: to study the epidemiology, understand the impact of the condition across the lifespan, and then also investigate the effectiveness of rehabilitation methodologies that target the areas that cause the most significant disability, which are the cognitive disabilities and psychosocial disabilities resulting from traumatic brain injury.
What are the most common causes of traumatic brain injury?
Across the industrialized nations, the two primary causes are motor vehicle crashes and falls. Now, the term motor vehicle crash is being used versus accidents because about 15-20 years ago we realized that most of those events are caused by human error and are preventable. So, for instance, lack of using seatbelt restraints, driving under the influence of substances, and so forth. So those are the two primary causes, in addition to sports. Sports typically result in more mild traumatic brain injuries, which are usually referred to as concussions. And it's very interesting to us because a lot of times the public is not aware of the fact that a concussion is a traumatic brain injury.
Right, and some of those things happen fairly regularly. How many people in Cyprus are injured seriously enough that they need quite long-term rehabilitation?
Okay, as we mentioned earlier, we don't have accurate statistics, but we do know from the intensive care unit data. We have been collaborating with the intensive care unit for a few years now as part of our effort to study the effects of chronic and significant moderate to severe traumatic brain injury. So we know, for example, that 60 people per year are hospitalized in the ICU, and that number probably encompasses most of Cyprus, because as we know, the intensive care unit of the Nicosia General Hospital is the premier trauma center for Cyprus. So a lot of times people from other hospitals are transferred to the ICU. There are also individuals that are treated in the neurosurgical department of various hospitals. So those numbers, we don't have them yet delineated, but that's part of the effort of the Brain Rehab Project, is to get a better understanding on the numbers of people who visit the emergency departments and are released, and the number of individuals that are actually hospitalized and are released. So that way we can get a more accurate estimation.
How easy is it for these people, if they are released from hospital after the initial treatment for whatever injury they have, but maybe their balance is off, their language isn't as it was? There are lots of different ways it can affect people, I imagine. Yeah. Where do they go if they need rehabilitation treatment that could last many months?
Right. So based on projections from other countries, we estimate that the cost of brain injury accounts for about 1% of the Cyprus GDP. So that's a very, very expensive condition, so to speak.
How do they work that out? Is this is people off work and people unable to go back to work?
So there are a lot of studies from other countries on health economics. There is a recent publication that came out of the UK. So they take into consideration the following: the cost of rehabilitation, the cost of years missed of productive life, the effect on family members who are often required to reduce their productivity and employment in order to take care of a person with traumatic brain injury, the long-term disability, because we used to think that traumatic brain injury was a one-time event, that once you were treated, then all was good. But in the last 15 years, we've gained an understanding that traumatic brain injury results in a chronic condition that affects the musculoskeletal, the neurological brain system, endocrine systems. And so it sets off a cascade that accelerates neurodegeneration. So it is a more chronic condition. And it
means, I suppose, that those people are more demanding of the health services, so that adds to the cost as well.
Exactly. So in the same publication, they took into consideration also what are the benefits, what are the savings resulting from effective rehabilitation. And again, they took into consideration the life expectancies, which are somewhat reduced for survivors of traumatic brain injury. The survival rate is reduced by about 7 years as compared to the non-injured population. And also took into consideration the cost of rehabilitation. And the estimated cost, again, adjusting for the Cypriot GDP, is close to €500,000 across the lifetime of the person with brain injury if they are rehabilitated effectively.
And are they rehabilitated effectively in Cyprus? Because we don't have stroke units, we don't have a lot of these specialised medical facilities
Correct.
That are available in other countries.
Correct. No, in Cyprus we have a fragmented system in terms of rehabilitation services. We don't have a rehabilitation policy in terms of how do you rehabilitate people with acquired brain injuries.
Do we have the staff?
We have staff in the areas of physical therapy, speech-language therapy, occupational therapy, psychology that are qualified and registered. And because neurorehabilitation requires specialized training, these are individuals that can be certainly educated and trained.
But we don't really have any at the moment because there's no special place they can go and work.
Some people have been trained as part of their academic and clinical training, especially if they have had the opportunity as part of their academic training to gain experience in neurological rehabilitation in other countries where they received their training. Now in Cyprus, the only comprehensive rehabilitation center is the Melatron Agoniston in Palodia, where the healthcare services rents out, so to speak, a number of beds per year, and they can refer individuals with acquired brain injury to receive comprehensive rehabilitation services. Always the question has to do with the intensity of training, the frequency of treatment, and the length of treatment. And we do have guidelines that have been published by reputable bodies such as the American Congress of Rehabilitation Medicine and other bodies. We have Cochrane reviews that talk about issues pertaining to intensity, dose, and response. So we have a long ways to go, and we're hoping through the Brain Rehab Project that we will make a contribution in terms of gaining a better understanding, but then also being able to obtain data that could inform policymakers.
How long is the project going to take? When will you have the results that you can hand over and maybe see something actually being put into policy?
So I'd like to tell you a little bit about the partners in the project, because I think we have really a dynamic network of partners. So the University of Cyprus, the Center for Applied Neuroscience, is the host organization and coordinates the project. But we also have the Nicosia General Hospital. We have collaborations with the mental health services and the neurology services and the ICU. And we also have the Melatron Agoniston, the rehabilitation center in Balodia, and also the Department of Social Inclusion for Persons with Disabilities from the Ministry of Labor, Welfare and Social Insurance. That department allocates benefits. So we've created this network in order to be able to capture people in the very acute, in the post-acute and chronic phases, and also gain better information in terms of the outcome and the effects. I'm also very excited about the clinical trials arm of the project. We are going to test the effectiveness of a cognitive rehabilitation program that I had developed in my lab in the US, and we have tested it in patients who were in residential post-acute rehabilitation. We have never tested its effectiveness in people who are on an outpatient basis.
So you'll have a chance to do that, but the final project results are expected when?
The final project results of everything, it will be in about 2.5, 3 years' time, but in between we will be releasing findings from different components of the project. We've already started with our collaborators looking at the data, for instance, from the Melatron Agoniston Diseoga. So we've already had a poster presentation at the center's annual conference in October from that data. So we are going to be releasing smaller components and disseminating those in different scientific fora, but also for the public as we are obtaining more information. But this is a 3-year project. And usually all of us who do studies with humans, we know that it takes time to recruit individuals in studies. You have to account for the human factor. But
within 3 years, you reckon you'll have results that can make a difference, maybe, to our health services?
We hope that we can make a difference. We hope that we can influence the general healthcare system. Right now, there's discussions, again, on rehabilitation services and policies. So hopefully we'll have the opportunity. We're going to seek out to make a difference. And also educating the public in terms of prevention. I think that's also a very important aspect. What is traumatic brain injury? What are the causes? How do you protect your brain? There is this motto of think first before you do things.
We've all got to do that. We've been talking to Fofi Konstantinidou, who is the project manager of brain rehab at the University of Cyprus.
You can subscribe to the Cyprus News Digest on iTunes for free and get the program downloaded to your phone or tablet so you can listen anytime, anywhere.
Well, Christmas is creeping up, or perhaps it's actually rushing up towards us. And at this time of year, for many years now, The traditional English pantomime has been part and parcel of the Cypriot cultural scene. Coming up this year, it's Sleeping Beauty, a traditional Christmas pantomime. If you're British, you probably know what that means, but I remember when the very first ACT pantomime was put on, Cypriot audiences were, to say the least, somewhat surprised at the genre. Joining us to tell us about it and this year's pantomime is the gentleman who plays the Dame. He is Graham Thomas. Graham, we do this almost every year and you tell us about the pantomime and so on, but for those who haven't been to see one yet, what should they expect?
They should expect a lot of fun. The pantomime consists of jokes, slapstick, singing, dancing, maybe a ghost might even turn up. Sweet throwing, kiddies on the stage helping the Dame with her magic trick. So it's a wide extravagance of acting, etc.
And the audience have got to get involved, haven't they? If you don't have that interaction, it can fall very flat. So how do you, when you're on the stage, actually jolly them along to boo at the baddies and cheer for the goodies?
Well, I think it really comes natural after the first time of the booing and the cheering and the he's behind you. But if it does go a bit quiet, the Dame tends to ad-lib, shall we say, and maybe focus on one area in the audience, like, is there anybody here from? Well, I think you ought to be shouting a bit louder, something like that, and really encouraging them to just make as much noise as they can. I mean, acting on the stage when the audience is really going for it, you can't hear what you're saying, let alone what a fellow actor is saying.
Of course, there are a lot of very young children in the audience as well, and I do recall one pantomime in years gone by where the baddie was so frightening that half of them burst into tears and had to be taken out. Now, that doesn't happen anymore. I think ACT learned its lesson, didn't it?
Yeah, that was a special sort of year, that was. I always remember
Aladdin,
it.
I think it was, wasn't it?
I think it was. And the baddie came on, and even I was frightened when I first saw him with his makeup and his costume. But yeah, we've tended to tone it down a little bit.
And the baddie and the goodie this year are ladies.
They certainly are. One bad fairy and one good fairy.
And so you'll get the kids booing at the baddie, cheering for the goodie. And of course they all know, if they've been before, that there's that sweet throwing in the middle of the afternoon.
Indeed there is. And luckily we have a load of sweets backstage, and when it's time, then those sweets will be thrown out and there's a mad scramble.
Tell us a bit about the actual Sleeping Beauty. I think most people have read the book, but how close does it stick to the story?
I think it does stick fairly close to the story about a princess looking for a suitor, sort of finding him, and the bad fairy gets her to prick her finger and she falls asleep for many years. And then we're all looking for the prince to come along to give her the kiss of life, to wake her up again. I won't say how it does end up, although it does end up with everybody smiling.
I was going to say they have to have happy endings.
Of
That
course.
is the one thing about a pantomime, isn't it?
Indeed, it always does, and even the Dame finds a boyfriend in the end, I think.
A little fairy told me that the Dame's looking for a husband throughout the pantomime, so you reckon she finds one in the end?
She does in the end, actually, but all will be revealed right at the end of the pantomime, and it will be actually similar to the first Sleeping Beauty that ACT did back in 1991.
So this has been done before, and people do know the story. It's going to be happening, I think you've got 6 performances?
Yes.
At the Russian Cultural Centre in Nicosia. Matinees and evening performances on Saturday the 30th of November and again on Saturday the 7th of December, and then on Sunday the 1st of December and Sunday the 8th, just an afternoon performance at 3 p.m.
Absolutely correct, yes.
Where can people get their tickets?
Our ticket number is 99593236. Email ticketsforact@gmail.com. gmail.com. That's tickets for act, all one word, at gmail.com.
And tickets are €12 for adults. Children between 4 and 12 years old pay €6. And I think for the first time, a family ticket's available. If it's 2 adults and 2 children between 4 and 12 years old, then €30 gets the whole family in to The Sleeping Beauty. Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.